Welcome back. Access to clean running water is becoming an issue at some health facilities affected by the floods in KwaZulu-Natal. Several cabinet ministers, led by Health Minister Joe Phaahla, provided updates on government's response to the floods. 98 shelters are also housing almost 8,000 people who've been left homeless. Our senior reporter Aviwe Mtila is covering this angle of the story for us. He joins us now live. So Aviwe, how bad is the water situation and how long is it going to actually take to repair it?
Well, it's severely devastated the water and sanitation infrastructure. I remember this was a conversation that I had with the deputy mayor in eThekwini just last week, who told me that 80% of those pipelines in eThekwini have been damaged. Of course, this has a ripple effect, given that today the health minister was suggesting that at least 66 health facilities have been infected by the floods. And in fact, a lot of them are trying to restore the water, and some of them are relying largely on water tankers. The dent and the amount that's needed to repair those facilities is at a staggering 190 million rand, and one of them has been totally closed off. It's a conversation that we had in the social cluster briefing led by the health minister, Dr. Joe Phaahla. Let's take a listen to that.
The health sector has lost the facilities which have been affected. 66 facilities have been affected, resulting in mainly roof leaks and flooding into the clinics and the hospitals. The breakdown of affected facilities as the different districts in terms of a breakdown is that in eThekwini there are 24 facilities, in the Ugu district 15 facilities from hospitals, health centers and clinics, Umgunguntlovu 9 facilities, in the Ilembe district there are 8 facilities, and in the King Kechwayo area 2 facilities. Fortunately, there has been minimum of disruption in terms of the core services for health. The cost of the repairs of the damaged facilities is estimated to be just a little under 190 million, but there is still further work being done to see whether this may need more, or maybe some of it can be done at a lesser fund. But at the average, this is what has been arrived at between our national health infrastructure team and the provincial health infrastructure team. Healthcare services continue to be ordered to displaced communities that are currently in the shelter halls. This includes making sure that those who are on chronic medication are visited, and they can be able to receive their chronic medication wherever they are.
And it's 2 weeks later, there are still thousands displaced. What's the short-term and long-term plans for them?
Well, the official number that we got today is around 8,400 people that have been displaced in eThekwini, and there is temporary shelter that's been provided, at least 98 temporary shelters that are being provided. Of course, hygiene becomes an issue as those people are clustered in, we understand, churches, some of them in the community halls, and of course the longer term plans and getting them to have their own stable shelters, for example, which we know the Department of Human Settlements is working on. Of course, there were other issues that were raised there by the Minister, Dr. Joe Phaahla, who leads the social cluster, in terms of the humanitarian aid that has come in to assist those people, of course, still coming in, and the donations that are still coming in that briefing, which we heard from him, talking about the people that have been displaced and what's happening there. Let's take a listen.
The priority is placed on providing immediate support, especially focusing on women, children, and older persons and persons with disabilities. So the department is working in collaboration with other stakeholders in executing the role of providing humanitarian relief, and as such has been able to establish 98 shelters where more than 8,400 people are housed in community halls, religious facilities, other temporary structures within the community. The majority of the people who are housed in the structures are women, more than 4,700, children over 1,700, and also older persons over 1,000, and also just over 200 people with disabilities. So working with the province and local municipalities, all the municipalities, eThekwini, Ilembe, all the districts, the DSD teams have been providing meals, cooked meals, blankets, dignity packs, working with churches, NPOs, corporates, to all the displaced individuals. Also working with community structures to provide food, and also working with development centers.
We'll leave it right there with senior reporter Aviwe Mtila.